Global Digital Exemplar here at Salford means that we have the absolute best digital solutions for our clinicians and our patients, and that enables them to care for themselves or their patients to world-class standards.
So what we're doing with our Global Digital Exemplar programme is coming up with a series of interrelated clinical projects whereby we look at the best clinical evidence and support these using digital technologies.
Patients are absolutely the focus of what we do here at Salford Royal, and we use digital technologies to help and enable them. Patients like Enid.
Well, I'd gone in my bed and I was just lay there, and then all the lights went out and I must have been dozing off, and I began to look round and I thought, I am wondering where I am here.
She asked me about a patient that was opposite her and the window, and she said, "There's something on the window." I said, "There's nothing on the window, Mum." I said, it was a drip stand and it was a saline bag. And I said, no, because Mum said it looked like a clown with a long face, and it was upsetting me more because I felt as though I wasn't getting through to her and it wasn't my mum.
So we have introduced some bespoke electronic tools to be able to assess for delirium, but they also enable us to code for delirium, and that's been vital in terms of really understanding the prevalence of delirium in our acute hospital.
I keep saying that I was never as frightened in my life.
So here at Salford we have the new delirium assessment tool, which is picked up really easy by us nurses. When doing the clinical observations, you can input that they have a new onset confusion, which will flag up to complete that assessment tool. The nurses will fill out that document and it will trigger to get a medic to come and assess this patient and see if this is a delirium, any underlying causes that may have contributed to it, and to then commence treatment.
So we spent a lot of time engaging with clinical leaders across the organisation to ensure that technology really is delivering for their patients.
We started with introducing technology in the emergency department about 5 years ago. And we were one of the first emergency departments that became almost completely paperless, with all clinical nursing notes and prescribing becoming fully electronic.
I think the biggest impact as a team is the productivity. We're able to see more patients, we have more time to spend with patients and less time needed to be spent looking at a computer screen.
I think the idea that we can checklist patients, we can see patients going through the perioperative process, and for that to all be paperless will be a massive advantage. I think the idea of us recording all the pieces of kit we use in theatre digitally will be brilliant.
As a rheumatologist, I look after people with arthritis, which is a long-term condition, and I tend to see them in the outpatient clinics once every 6 months or so. We looked to collect daily symptoms using a smartphone app, but uniquely integrate that data into the electronic health record. It was really easy to use for the patients. We had a set of questions every day and a set of questions weekly and some monthly.
NHS England have awarded us the Global Digital Exemplar status because they want us to lead the rest of the NHS in transformational change enabled by digital.
Another opportunity is the Fast Follower programme, and this means that we can partner with other organisations to co-design and co-develop technology initiatives to improve patient care across a much broader area than we are within Salford Royal. And this is something that we'll be looking to develop over the coming 2 years.
We need to consider other sites that are less digitally mature, but that's absolutely the remit of Enid, that we learn how to do things well and develop the blueprint for how they can be done elsewhere at scale across the NHS.